Hello, everybody. Hello. Happy Monday. Let me know if you guys can hear me in the chat, and we will go ahead and get started. Hello. Okay. Awesome. Thank you guys so much. So, yes, hello again and welcome to another week of our ICD10CM Guideline Mastery sessions. As always, I am Ms. Haley. I'm going to be your lead instructor for this class, and I am so excited to welcome everyone to our Monday night class. We are beginning week 6. I cannot believe we are already in week 6. Time is just flying on by. And I am also here with our lovely interns, Miss Olga and Miss Vina. They are going to be in the chat helping you guys out, encouraging you, or answering any questions that you guys have. So super happy to have my team with me here tonight. So like I said, we're going to be in week 6 today. So we're going to go over chapters 10 through 14, and those are going to be our respiratory, integumentary, musculoskeletal, and our urinary guidelines. I'm going to be using our ICD-10CM guidelines and also referencing our MCG manual in this session. So make sure to have those both handy if you can. And we are going to keep the same flow as we have been. So we're going to do our warm-up Jeopardy game first, and then we're going to move into some of our in-depth scenarios. So we are going to go ahead and get started. And as always, I'm just going to say in the beginning as well, thank you to everyone that turned in their surveys last week. If you have any questions in the meantime that don't get answered by our wonderful team, definitely click that link. It will be posted in the chat, and you can ask your question. I will get back to you as soon as possible, or just let us know how we're doing for the class. It would definitely be appreciated. All right. Without further ado, I'm going to thank you, Miss Olga, for putting that in the chat, and we'll put it throughout the class as well. All right. I'm going to go ahead and read our super long copyright, and then we will go ahead with our Jeopardy game. So, ICD-10CM Copyright 2026, American Medical Association, all rights reserved. Fee schedules, relative value units, conversion factors, and/or related components are not assigned by the AMA, are not part of CPT ICD-10, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, CHUN, AMCI Fab 7, AMCI ICD-10, FLIP, TAB, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHEMA. AMCI does not own the rights to these credentials. All right. Now, without further ado, we are going to go ahead and jump straight into it. So I'm going to stop sharing my screen, and I'm going to go ahead and bring up our Jeopardy game. For those of you that are new, this Jeopardy game, it's just going to be a round of true or false. They're all going to be true or false questions, and I'm going to be taking them directly from the MCG manual, so our ICD-10 guidelines, and I will be referencing each individual guideline afterwards. So if you're curious as to what that guideline looks like, I will go through it at the end. All right. So I have split it up into our chapters we're going to be going over. So we're going to be doing chapter 10, which is going to be diseases of the respiratory system. We're skipping chapter 11 because it tells you to go to a different section of the guideline. So we're just going to go with chapter 12, diseases of the skin and subcutaneous tissue. Chapter 13, diseases of the musculoskeletal system and connective tissue. And chapter 14, diseases of the genital urinary system. Okay, so without further ado, let's start with a 100 just to get us eased into it from chapter 10. And again, these are all going to be taken directly from the MCG manual. All right. So, true or false? For patients presenting with conditions related to vaping, assign U07.0 vaping related disorder as the principal diagnosis. Is this going to be true or false? Let's start off strong, coders. Put those answers in the chat. All right, starting out with some amazing responses. Great participation in the chat. Keep it up. So, yes, this one would indeed be true. Everyone put that one. That was a great start, a great warm up to our warm up game. So, let's keep the ball rolling. Let's go to chapter 12. Let's do a 200. All right. Again, true or false? If a patient is admitted with a non pressure ulcer at a certain severity level that progresses to a higher severity level during their stay, only assign highest severity level during admission. So only use one code. Is this going to be true or false? Let me know in the chat. All right, I'm getting some mixed responses for this one. So, this one, believe it or not, is actually going to be false. You would think you would only assign your highest severity level, but, and again, I will reference the exact guideline later, but it says that it's IC12B3. But it says if a patient is admitted with a non-pressure ulcer at a certain level, at a certain severity level, progresses to a higher severity level, you're going to assign two separate codes. You're going to assign one for the ulcer site and severity at the time of admission, so present on admission or POA, and the second for site and highest severity level reached during the admission. And then the code for the present on admission or the POA code should be sequenced first. So with this one, you're going to be using two codes, and then the one that you're coding for how the site and severity was on admission, you will code that one first. So that's what makes this one false. If you caught that one, great job. Okay, now we're going to move on to chapter 13. Let's do a 300. All right. So, true or false? The seventh character D is used for encounters after the patient has completed active treatment for a pathological fracture and is now receiving routine care during the healing or recovery phase. So, what are we using that seventh character for with this treatment for a pathological fracture? What are we thinking? I know this is a long one, so I'll give you guys a few seconds to let it marinate and let me know. All right, I'm getting a lot of amazing responses for this one. So yes, this one is going to be true. That is what that seventh character D, that is when it's going to be used for. In contrast, you would use the seventh character A for the pathological fracture that indicates if the patient is receiving active treatment for the fracture. So active treatment, you would use the seventh character A, but since this is healing or recovery phase, the seventh character is going to be D. So amazing to everyone that got that one correct. All right, let's move on to chapter 13 or chapter 14. I don't know what I'm saying today. Okay, chapter 14, disease of the genital urinary system. Okay, true or false? Sequence CKD or chronic kidney disease with diabetes or hypertension codes using notes in the tabular list. True or false? You guys got this one. I'll give you a few seconds. All right. So yes, this is where is my mouse? So yes, this one is going to be true. This guideline is a lot longer, so I kind of just shortened it. But yes, you should definitely, when it comes to chronic kidney disease, who also have conditions like diabetes mellitus or hypertension, you should definitely follow up the guidance provided in the tabular list just to ensure proper sequencing based on all your coding conventions and all of that good stuff. So amazing for those that put that in the chat. I'm just loving this participation. You guys are always killing the participation every Monday, I swear. All right, let's keep it up. Let's go back to our chapter 10, diseases of the respiratory system. Let's do a 300 now. Oh, this is a long one. All right. So, if a patient is admitted with a type of pneumonia, so for example, J13 pneumonia due to Streptococcus pneumoniae, and later develops a ventilator associated pneumonia or VAP, the code for the admission pneumonia should be assigned as the principal diagnosis. So they come in with one type of pneumonia, it develops to ventilator associated pneumonia. Are we assigning the original pneumonia as the principal diagnosis? Yes or no? All right. So this one is going to be true. This one is going to be true. So when a patient is admitted with one type of pneumonia and it develops to that specifically ventilator associated pneumonia, you are still coding the first type of pneumonia they came in with as the principal diagnosis. Yes, that one was a little bit of a difficult one. And again, I will reference the exact guidelines so you can go back and look at it word for word just to get a little bit more practice. But yeah, these chapter 10 through 14 have a little bit of some difficult ones there, but that's okay. That's why we're here. Practice makes perfect, and I appreciate all the participation in the chat. So let's move right along. Let's go back to our chapter 12, diseases of the skin and integumentary. Let's do a 100, and we're back to ulcers. So, true or false, if a non-pressure ulcer is documented as completely healed at the time of admission, an ulcer code should still be assigned. Is this going to be true or is this going to be false? What do you think, coders? All right. Getting a lot of answers in the chat. Let's see. Indeed, this one is going to be false. So yes, if a non-pressure ulcer is documented as completely healed at the time of admission, no code should be assigned. So that is what makes that false. No code should be assigned, especially if it's healed. So great catch, everyone. Great job. I think everyone got that one right. So great work. Okay, let's move back to our chapter 13, diseases of the musculoskeletal system. Let's do a 200. Okay, so category M81, which is osteoporosis with current pathological fracture, applies to patients who have a current pathological fracture caused by osteoporosis at the time of the encounter. So what is category M81? Is this going to be true or false? And then again, this is going to be from our chapter 13. So if you're looking for the guideline in there, it'll be located in there. Okay, this one was fast. I'm getting an overwhelming response in the chat, an overwhelming response of false. I'm getting a little bit of mixed. But yes, I was trying to be a little sneaky here. Yes, this one is false. So the reason that it's false is because category M81 is the category for an osteoporosis without a fracture. So it's the wrong category. That's what makes it false. So category M80 is the category for osteoporosis with current pathological fracture that applies to patients who have a fracture caused by osteoporosis. So that's what makes this one false. This is true if it was category M80, but instead it's category M81. And so that's what is making it false. If you got that one wrong, it was a super small, again, I was trying to be sneaky. So, and if you caught it, amazing job. And that's why we're all here. Again, practice makes perfect. So you guys are doing great. Let's keep it up. Let's go back to chapter 14, diseases of the genital urinary system. Let's do a 300. Oh, I did not mean to put this one in here. Okay, that's fine. With chronic kidney disease, what is stage 5 severity also known as? This is supposed to be true or false, but we're getting a multiple choice. We're throwing that in. So, chronic kidney disease, stage 5 severity, what is it also known as? Is it known as moderate chronic kidney disease, renal disease, end stage renal disease, or mild chronic kidney disease? I know you guys know this one, so I'm not worried about it. So let me know. Let me know in the chat. All right, indeed. Indeed. I was trying to crank the difficulty on this one, and I guess I forgot to switch it out. But yes, indeed, this one is going to be C for end stage renal disease, or sometimes you'll see that just ESRD. So great job, guys. I feel like that was an easy one for 300, but that was an overwhelming response in the chat. So great job. Yes, killed it indeed. All right, let's move back to chapter 10 and close this one out for 200. Okay, so acute respiratory failure, or ARF, should not be coded as a secondary diagnosis if it develops after admission or if it is present on admission and should be coded as principal diagnosis. What? If it develops after admission or if it is present on admission. Okay, I'll give you guys a minute to read that over. I know that's a lot of words, and let me know in the chat. All right, amazing job. I'm getting a lot of falses, and indeed, this one is false. So the code specifically, or the guideline, I'm sorry, specifically states that acute respiratory failure, or ARF, may be coded as a secondary diagnosis if it develops after admission or if it is present on admission but does not qualify as principal or first listed diagnosis. And so that's what would make this all kinds of false. So if you caught that one, great job. And I think a lot of people did. So shout out to you guys. All right, now let's close out our chapter 12, disease of skin and integumentary system. Let's do a 300. Okay. True or false? If an ulcer was present on admission but has healed by discharge, assign only site and stage as it was on admission. What do we think for this one, coders? True or false? All right, so this one was kind of piggybacking off of the other guideline. So this one is going to be, this one's going to be true. So obviously you can't have more codes because we have a site and stage on admission, and we don't have the highest severity because it was healed by discharge. And so that's why we just need that one code for the site and stage on admission. And that's what makes this one true, which everyone got right. So great work. Outstanding indeed. Okay. Let's go back to our chapter 13, diseases of the musculoskeletal system for 100. Okay. True or false? Code the bone, not joint, for conditions near joint ends. So, an example would be osteoporosis and avascular necrosis. So, are we coding bone, not joint, for conditions near the joint ends? True or false? Okay, I'm seeing some responses. So this one is going to be true. Um, this one is going to be true. So yes. So an example of this would be like a patient is diagnosed with avascular necrosis at the end of the femur near the knee joint. So although the affected area is near the joint, the code should be assigned to the bone. So that is what makes this guideline, this is what makes this one true. So if you got that one, way to go, way to go. All right, and let's end our warm-up Jeopardy game on a great note. You guys have been doing amazing so far, so let's keep it up with our last chapter 14, diseases of the genital urinary system. Oh, and it's a long one. Okay. So, true or false, for patients with kidney transplant who still have chronic kidney disease, the chronic kidney disease itself is not considered a complication of the transplant unless there is documented evidence of transplant failure, rejection, or other specific complications. All right, let's end this game strong. Let me know in the chat what you think this is, true or false. All right, I'm getting an overwhelming true, and you guys would be 100% right. It just makes sense when you read it out. It just makes sense. And I guess it made sense to everyone because I think every single person got it right. So we did really end on an amazing note for this game. So shout out to you guys. All right, that was a great warm up. I'm going to stop sharing my screen for just a second, and we are going to go back to our presentation just so I can quickly click through the specific guidelines that I used. So if we want to use this as an extra study tool so we can look at the exact guidelines, then go for it. I'm going to be quick with this. Just click through it, and this is recorded so you can always pause. You can always look back at this video and pause it so you can have all the time to look at these. So again, these are going to be all the questions, all of the answers, and then this is going to be the specific guideline. I labeled them how you would find them in the MCG manual, but you can find them in the MCG manual or the ICD-10 if you need to do that. So this is for our chapter 10, diseases of the respiratory system. This is for our category 2 or chapter 12, diseases of the skin and subcutaneous tissue. Again, question, answer, guideline. This is going to be category 3, chapter 13, diseases of the musculoskeletal system and connective tissue. And then last but not least, this is going to be our category 4, chapter 14, diseases of the genital urinary system. This was the question that I was going to change, so this one looks a little bit different. So it was going to be a patient's record indicates both stage 4 and ESRD. Only stage 4 should be coded. Obviously, this is false. So that is the guideline. So that was just a little bit of a difference. But other than that, those are all of the questions and answers for that one. All right. Now I'm going to stop sharing one more time. And we are going to go over to our Quizlet. Oh my goodness. Excuse me. So if you are new with our Quizlet, I'm going to give you guys a scenario. And we're going to break it down into every single small component. So we're going to break it down first into our keywords. We're going to take that out of the scenario. Then we're going to find the guideline we're going to be referencing. And then last but not least, we are going to put together the specific ICD-10 codes we're going to be using. So this is going to be our first. This is not. Hold on. Bear with me. Don't look. Close your eyes. Okay. Sorry about that. It started from the end. So this is going to be our first scenario. So Dr. Kepner diagnosed Mr. Jora with CKD or chronic kidney disease stage 5 and ESRD or end stage renal disease. So what keywords are we reporting for this? I know it's a small scenario starting off, but I think we know what keywords to take away. Put them in the chat. All right. Yes, indeed. And if you're still typing, I know some people type fast. I do not. So still put your answers in the chat. But yes, our chronic kidney disease, stage 5, and our end stage renal disease. That one was pretty straightforward and everyone got that one. So great job. All right, now we are going to move on to what guideline we're going to be using. You can do the number or like the title, however you want to do it. But what guideline are we going to be using to solve this scenario? Put it in the chat and then we will move on to our codes. All right. I was about to give you guys a hint and say it was from chapter 14, but we didn't even need that hint because everyone was spot on with this one. It is indeed going to be IC14A1, and the title for that is going to be Chronic Kidney Disease or Stages of Chronic Kidney Disease. All right. So great job. You guys are killing this scenario. So now, without further ado, we're going to use those keywords. We're going to use that guideline. And now, what code or codes are we going to be reporting for this scenario? Put it in the chat, and then I will switch over to our PowerPoint so we can go over and see how it looks all together. Everyone was so fast with this scenario. If you are still solving, no biggie. I'm just going to switch over to our PowerPoint so we can see how everything looks all together. And then we still have 2 more scenarios after this one. Ooh. Okay. Here we are. Whoop. So, yes. So, diagnosed with chronic kidney disease, stage 5, and ESRD. So, we are taking out our chronic kidney disease, stage 5, and our end stage renal disease. As everyone put, this is going to be our guideline. This is going to be taken straight out of the MCG manual. And you can see that this chart is super, super helpful when it comes to coding these kinds of situations. So we, according to these guidelines, if they have like stage 5 and ESRD, we're only going to be coding for the highest level. So we don't need to code for that stage 5. We just need to code for the end stage renal disease. So if you go down here, it's organized all nice and neat. You can see end stage renal disease. The code for this is going to be N18.6. And so that is just going to be our one code that we're going to be using to solve this, which is end stage renal disease, N18.6. So if you got that one, and so many people did and put it in the chat, that was great. I feel like that was a good warm-up scenario. Everyone's really getting used to how we're doing these. So shout out to you guys. Always impressive being able to just take codes directly from a scenario and not looking at any multiple choice. So that was great work. So I'm going to switch right back over to our Quizlet, and then we are going to work on our second scenario for the night. And we're going to start right back off with our keywords. So, a 73-year-old came into the ED with severe shortness of breath and goes into respiratory failure. He was intubated and admitted for acute respiratory failure. Chest x-ray shows he has pleural effusion. So what keywords are we taking out of this scenario? We're cranking it up a little bit. Let me know in the chat. I'll give you guys a few seconds to type it out. Okay, I'm getting some awesome keywords in here. So what I'm taking out, respiratory failure, the acute respiratory failure specifically, and the pleural effusion. You can also focus on the shortness of breath as well. There are definitely things to be focused on in here, but I would definitely focus on the respiratory failure aspect for sure. But everyone seemed to be focusing on the same thing, putting their answers in the chat. So great work. Now we are going to move right over. You guys know we are going to be using the same scenario, looking at the keywords. Now, what guideline are we going to be using from this? I'll give you guys a hint. It's going to be from chapter 10, Diseases of the Respiratory System. So with that hint, put it in the chat and then we will go over it. Okay, I'm getting some responses. Alrighty. So yes, it is indeed. Everyone put that. It is going to be guideline IC10B1, and the title for that is going to be acute respiratory failure as a principal diagnosis. So great job, or if you were in the realm of that, great work. And now, but last but not least, we are going to be focusing on the code or codes that we're going to use to solve this scenario. So let me know in the chat what you think they are, and then I will go ahead and switch over to our PowerPoint and we will go through everything all together. All right, if you're still working on it, no worries. I will not give away the answer just yet. I'm simply going to switch over to our PowerPoint presentation so we can see how everything looks all together. All right, bear with me. Okay, so let's move on. So, of course, this is the scenario we were just going over. The keywords we're taking out of here are respiratory failure, specifically acute respiratory failure, and the pleural effusion. So this is going to be the guideline we're going to be referencing, IC10B1, acute respiratory failure as principal diagnosis. So it kind of shows right here on the right how, like, what code should be used when acute respiratory failure is reported as the principal, and that's what we're going to be using as a principal diagnosis. So we see our J96.0 is acute or subacute, our J96.1 is chronic, and then J96.2 acute and chronic. So there was no mention of chronic, so we are going to be using, so right here it definitely says the doctor must determine whether acute respiratory failure is the reason for encounter. So it says right here, admitted for acute respiratory failure. So that would determine it being the principal diagnosis. So again, when we're looking at this right-hand side, we see that it is specifically acute respiratory failure. So that is why we're picking our code J96.00. So this is going to be acute respiratory failure, unspecified, whether with hypoxia or hypercapnia, because obviously that was not listed anywhere in this scenario. So that is going to be our first listed code, and this is going to be two codes because after you code for the acute respiratory failure, then you're going to have to code for the pleural effusion that they found for the chest x-ray. So you're going to go and look for that code, and you are going to find J90, pleural effusion, not elsewhere classified, pleural effusion NOS. So those are going to be the two codes, and that is how you're going to sequence them, J96.00 and J90. And I see a lot of people putting that in the chat. I see a lot of people on the right track, but definitely don't forget that pleural effusion. Got to include that one. But great work, everybody. I'm so happy with all of the responses in the chat. You guys are doing great. And as always, if you have any specific questions, I hope that that explanation kind of helped with anyone that had any confusion about this scenario. But If you have any other questions that you want to ask, again, we have that link that you can click on to the survey, and I look through all of them tomorrow. So I will definitely get back to you as soon as possible with that one. And I will be happy to answer any questions you guys have. So now we are moving back and we are going to do our last coding scenario of the night. I feel like you guys are just flying through these. Normally we take our time, but you guys are just going through them. I love it. Okay. Now if my mouse will work. Okay. So last scenario for the night, we're going back to looking at our keywords. So Mrs. Willow, a 65-year-old, has developed a pressure ulcer on her right hip. The base of the ulcer is covered in eschar, and the provider documents that the stage of the ulcer cannot be determined. What ICD10CM keywords are we going to be reporting for this scenario? Let me know in the chat. All right, exactly. So yes, pressure ulcer, we got that right hip. And then also it's good to mention that the stage of ulcer cannot be determined. So everyone got that one. Great job. Way to put that in the chat. And now we are going to be moving on to our second part of this scenario solving. Now we're going to be focusing on what guideline to use. I feel like I don't even need to give you guys a hint, but it is going to be in chapter 12, that integumentary system guidelines. Oh my goodness, we're already putting codes and stuff in there. Okay, I'll give you guys just a few seconds and then I'll go over it. All right. And indeed, I'm getting overwhelming responses. Well, why is there not an answer on there? It is going to, yes, everyone got it right. It is going to be the IC12A2. I don't know why that's not on there. But yes, it is going to be IC12A2, the unstageable pressure ulcer. So that is what is going to be used. So if you got that one right, I don't know why there's just 3 dots on there. But yes, that is the code that we're going to be using 100%. All right, and now we are going to move on to our final part on our final scenario. We are going to be selecting our code or codes for this. So let me know what we think, and then we will go over to our PowerPoint for the last time and go. Oh no! Can you guys? I saw Miss Venus said that we lost the audio for a second. Can you guys hear me now? I'm gonna stop. Oh no! I'm gonna stop sharing and switch over. But let me know in the chat if you can hear me, and we will go over. We can hear you again. Yay! Sorry about that, everybody. Okay. My computer just decided to be sassy. Okay. So here is our scenario. So again, 65-year-old, pressure ulcer on her right hip, base of the ulcer is covered in eschar, and the provider documents the stage of the ulcer cannot be determined. What codes are we reporting? So as everyone said, we're going to be focused on that pressure ulcer, specifically the pressure ulcer on the right hip. Also that the stage of ulcer cannot be determined. And I also got an overwhelming response of what guideline we're going to be using. This is a big one. So yes, IC12A2, pressure ulcer, stage codes, unstageable pressure ulcer. That is like a mouthful. That's so many. Okay. So right here, we have a category for unstageable, and then we have a code for unspecified. So that's where the keywords kind of really come into importance, because you got to focus on what specific wording we have on here. So right here, it just says that it cannot be determined. So we would be coding from right here. So that would fall under the unstageable category, because it says the stage cannot be clinically determined. That is what the physician is saying. So that is what category we're going to be selecting. So with that being said, we are going to go into our ICD-10 manual, and we are going to find a code, which is going to be L89.210, and that is going to be pressure ulcer of the right hip, and that is going to be unstageable. All right, which so many people, I got an overwhelming response of people that put that in the chat. So if you put that in the chat, or if you were on the right track, amazing, amazing, amazing job. It's really not easy to, look at a scenario and be able to break it down into those small components. So hats off to you guys. Yes, AMCI, amazing. So I know that we are leaving we're leaving 5 minutes early. And since you guys did such a great job, I'm going to have to crank up the difficulty on these scenarios, I see, because you guys are just doing amazing. So I want to make sure you guys have the best learning experience possible. That being said, I know I've already mentioned it. Please fill out this survey and let us know how we're doing, so that we can make these classes better for you guys, so that you can have the best learning experience possible. As always, huge, huge shout out to Miss Olga and Miss Vina. They're just amazing, amazing cheerleaders and great resources to have in the chat. So definitely appreciate them being here on our Monday night. And I also appreciate you guys being here on our Monday night. I hope to see you next week. We are going to be in week 7 already, which is going to be crazy. I believe next week we're going to be doing our pregnancy guidelines. And I know that some people specifically wanted to do that one. So definitely make sure that you join for those. And I hope that everyone has a wonderful, amazing rest of their week, and a wonderful, amazing rest of their Monday. Thank you guys for coming out, and I hope to see you next week. Have a great day, guys.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI.